Hello, my name is Allison Cunningham, and I'd like to speak on behalf of my support for Bill HR 1309, which is a bill that supports healthcare violence prevention measures. I have been an ER nurse for over 8.5 years. And in those 8.5 years, I have seen numerous coworkers assaulted as well as been assaulted myself. This bill has bipartisan support. It has a lot of support from a lot of different organizations. And it passed in the House in 2019, and hopefully it will pass in the Senate. Physical assaults on healthcare workers are extremely numerous. Despite only making up 20% of the workforce, healthcare workers account for 50% of all assaults. In the emergency department where I work, it's even higher. Emergency departments are considered vulnerable areas because of the 24-hour nature of emergency departments and the ease of access that patients and visitors can get into emergency departments. So just in ERs, 50% of emergency physicians report being assaulted, and 82% of emergency nurses report being physically assaulted. Nearly 1/3 of ER nurses have reported that they've considered leaving the profession because of workplace violence. And 100% of ER nurses report being verbally assaulted. This equates to over $4.2 billion a year, and it affects healthcare delivery as well as staff retention. In Massachusetts, as a nurse, you're more likely to be assaulted on the job than you are as a police officer or a corrections officer. In my case, personally, I was physically assaulted on the job in 2016. I did press charges, but most of my coworkers and most nurses in general that are assaulted do not press charges. And I've also experienced a lot of barriers when I attempt to report verbal threats or assaults from hospital staff. Many assaults aren't reported, and most nurses feel they shouldn't report an assault because of patient's state of mind, their mental status or their emotional status when they come into the ER or into a hospital, or because of their age. And many nurses also feel that it's part of their job. Most of my coworkers have been assaulted on the job. I've worked with 3 that have retired as a direct result of being assaulted, 1 that had a fractured jaw, 1 that has chronic headaches, and this is just from my 1 emergency department. HR 1309 directs OSHA to require employers to develop specific workplace violence prevention measures. And by doing this, we will be able to track violent attacks and ensure that employees are fully aware of their rights of workplace violence. Many states have already implemented these measures. Nevada, California, Oregon, Washington, and California have all already implemented workplace violence prevention measures. And it's clear from these statistics that something needs to be done with healthcare violence, and it should be considered a necessary step in advancing health and wellness of the American population. Thank you.